Welcome everybody, my name is Dr. Andrew Thembo and I'm a medical oncologist, and welcome to episode 2 of the Cancer 101 series. In this episode we shall be discussing where does cancer come from and what are some of the risk factors. In case you missed episode 1 where we discussed what is cancer, you can catch that episode in my socials on Facebook, Instagram and TikTok. So let's jump right into it. Where does cancer come from? So you remember last week we talked about cells that divide uncontrollably. Well, these cells have a genetic problem, and sometimes this genetic problem, you could be born with it or you could acquire it later in life. Those that you could be born with are called cancer syndromes, inherited cancer syndromes, which you have defects in your genetics that make the cells become more likely to develop cancer. And some cancers include breast cancer, colon cancer, cancer of the ovary, and also cancer of the kidney. Being born with these inherited cancer syndromes does not mean that you must get cancer later in life, but it does increase your risk of getting cancer compared to that of an individual without these syndromes. Now, the acquired risk factors are many, and some of these you will be exposed to them later in life. These include harmful exposure to UV radiation from the sun. It includes chronic infections from viruses like hepatitis B, human papillomavirus, and hepatitis B viruses. Some parasitic infections have also been shown to cause bladder cancer. When you have chronic inflammation of the organs, for example, a condition which we call ulcerative colitis, which is inflammation of the colon, can later lead you to having an increased risk of developing colon cancer. You have things like smoking and excessive use of alcohol, as well as exposure to chemicals. And sometimes these chemicals, we can't know them. They could be found in fertilizers, in industrial chemicals, in hair dyes, and all manner of things. We could be exposed to chemicals that we don't know are causing us to have a high risk for getting cancer. So some of the other risk factors for cancer include your age. The older you grow, the higher the chance that you could get cancer. And it is true that most cancers are seen in the elderly population. The older you grow, your cells lack the ability to repair themselves after they have been damaged by these risk factors that we've been talking about. So cell repair is poor, so you have a chance of getting cancer. The next risk factor is your family. So if you've got cancers running in your family, or if you've got a parent or a grandparent with cancer, then naturally your risk of cancer acquisition later in life is higher. Though this doesn't mean that if you have a parent or a grandparent with cancer that you must get cancer eventually. The other risk factor is your habits. Excessive alcohol use, cigarette smoking, unsafe sex, poor diet, lack of exercise, living a sedentary life, all have been shown to increase the risk of getting certain cancers. And lastly is your environment. Where do you live? Do you live in a polluted area? Do you live near industrial factories where there's a lot of exposure to unknown toxins? Is your housing material containing asbestos, and so on? So the risk factors could be many, and I hope I've really empowered you with knowledge, dear Kenyans, dear followers. And stay tuned for my next episode next week, where we shall be talking about what are the common signs and symptoms of cancer. Don't miss out. If you've missed any episode, please log into my socials. You'll be able to catch the previous episodes there. Thank you so much for your attention, and peace. Take care.